Today, I want to talk about a serious health issue that is affecting millions of people around the world: obesity and diabetes. These two conditions are deeply intertwined and have become major public health challenges in recent decades. The rise in obesity rates has been alarming, and as a result, we have seen a parallel increase in the number of people living with diabetes. Let's start by discussing obesity, which is defined as having an excess of body fat. It has become a global epidemic, affecting people of all ages, races, and socioeconomic backgrounds. Sedentary lifestyles, unhealthy eating habits, and a lack of physical activity are some of the key factors contributing to this epidemic. With the rise of technology and the prevalence of fast food, our society has become more prone to a sedentary lifestyle and the consumption of highly processed, calorie-rich foods. Obesity comes with a myriad of health risks, such as heart disease, stroke, certain types of cancer, and sleep apnea, just to name a few. However, one of the most significant and detrimental consequences of obesity is the development of type 2 diabetes. Type 2 diabetes is a metabolic disorder characterized by high levels of blood sugar due to either the body's resistance to insulin or the inability to produce enough insulin. The link between obesity and type 2 diabetes is undeniable. Excess body fat can impair the body's ability to efficiently utilize insulin, leading to insulin resistance. When the cells in our body become resistant to insulin, glucose accumulates in the bloodstream, resulting in elevated blood sugar levels. Over time, this can lead to the development of type 2 diabetes. Furthermore, obesity-induced inflammation plays a crucial role in the progression of diabetes. Adipose tissue, commonly known as body fat, produces inflammatory markers that contribute to insulin resistance and the destruction of pancreatic beta cells, which are responsible for producing insulin. This vicious cycle perpetuates the development and worsening of diabetes. So, how can we address this complex issue? Prevention is key. It is vital to promote healthy lifestyles from a young age and encourage regular physical activity. By instilling healthy habits early on, we can reduce the risk of obesity and the subsequent development of diabetes. Educating individuals about proper nutrition and the importance of a balanced diet is also crucial in preventing obesity. In addition to prevention efforts, we must also focus on improving access to healthcare services for individuals already living with obesity and diabetes. Regular checkups, diabetes management programs, and access to medications and insulin are essential in managing and minimizing the long-term complications associated with diabetes. Apart from the individual responsibility, policymakers and governments also play a pivotal role in addressing this public health crisis. Implementing stricter regulations on the food and beverage industry, such as limiting the marketing of unhealthy foods to children and imposing higher taxes on sugary beverages, can help curb the obesity epidemic. Investing in public health campaigns that promote healthy habits and raise awareness about the risks of obesity and diabetes is also crucial. Furthermore, creating environments that promote physical activity, such as building more parks and recreational facilities, can encourage people to lead active lifestyles. Additionally, ensuring access to affordable and nutritious food options, especially in underserved communities, is essential in tackling this issue from a systemic perspective. Lastly, it is important to approach this topic without stigma or blame. Obesity and diabetes are complex conditions influenced by a multitude of factors, including genetics, environment, and social determinants of health. By fostering a supportive and inclusive environment, we can ensure that individuals living with obesity and diabetes receive the care and support they need to manage their conditions effectively. In conclusion, obesity and diabetes are intertwined health challenges that require a multifaceted approach. Prevention efforts, access to healthcare services, policy changes, and supportive environments are all critical components in addressing this epidemic. By working together, we can tackle the obesity and diabetes crisis and improve the overall health and well-being of our society.